three states. So Tri-State Child Health Services is the name of our Cincinnati area, tri-state area, really, because Cincinnati in geography sits right on the border between Kentucky and Indiana. So we have pediatricians from mostly greater Cincinnati, northern Kentucky. We have a few from Indiana. We're starting to expand a little bit into Kentucky. We've got a practice from Lexington that's going to be joining. And it's essentially, it's a clinically integrated network. We're actually celebrating our 30th anniversary. It was founded in 1995. Really, the goal of Tri-State is to improve the care of the children in the tri-state area, provide quality care at a lower cost. And we essentially, it's a collaboration between independent pediatricians and Cincinnati Children's Hospital. And so that includes, there's really what's called 4-member groups. So there's the independent pediatricians, there's the Cincinnati Children's primary care physicians, there's the Cincinnati Children's specialists, and then the hospital itself is represented as well. And PHO's done lots of quality work over the years. For many years, they did a very large asthma cohort study. More recently, they've been doing some work in depression and screening in depression. I have now been medical director for about 2 years. It's been about my 2-year anniversary. And we have gone through a little bit of a redesign. We've built our operations team and we've developed certain cohorts that pediatricians need to focus on. So right now, we're focusing on mental health, depression, anxiety. We're still doing asthma work, constipation, right? So the goal is we should be treating most constipation, we should be treating in our offices. They don't need to go to see a pediatric gastroenterologist. We need to save them for my kids with EE or other things that I can't manage, and that helps save payers, right? Because it's going to be less expensive and probably better to keep them in the medical home. We're also doing primary recurrent headaches. And then we're developing a cohort on obesity. So really, that's a beast in and of itself. And we're trying to figure out how to tackle that. We're going to look at some dental work. We're also doing some work in the perioperative space. So going to work with our anesthesia colleagues in Cincinnati Children's and how can we help provide education to both pediatricians and families, increase the rate of same-day surgery cancellation. So maybe the parents didn't quite understand what NPO meant, or the family calls the pediatrician because they're sick. Should they go to the surgery? So those are all the things we're working on. And we really do, we develop educational modules that we send out to our members. And then we also do quality improvement work. So we've just embarked on a Part 4 MOC, large scale network wide anxiety project, looking at increasing screening of anxiety at every child visit for kids 12 to 17, as well as screening at all visits related to anxiety. And then obviously some of our outcomes we're looking at are decreased ED utilization, decreased hospitalizations for anxiety, very similar to what we did with depression, where we did see a decrease in both ED visits and hospitalization. It's really a unique, not only for patient care, education, quality improvement, but again, especially for those of us in independent practice. And one of the reasons I think we currently still have 27 independent practices in the greater tri-state area, because through the PHO, we are able to share PHO network level contracts. We have very good contracts with private insurance, with the exception of Anthem. Anthem is completely separate and we're trying to work with them. And then of course our managed Medicaids, but it's a win-win for practices, for the patients. Yes, again, but George, you go back to that question about research. Why do I do this? Why do I have to do this QI project? Why do I have to fill out? Why do I have to watch these educational videos? It's because by doing this, it allows us to get you a really good payment rate. So at the end of the day, and obviously you want to take care of your kids and your learning, but ultimately from a financial standpoint, that has really been helpful in keeping independent pediatrics somewhat strong in our area.